Hello everyone, this is Dr. Swapnil Chandratra here. How are you all? It has been a long time. I would like to say that I have cleared my FSP exam, and today I am going to share you my personal experience of the FSP exam which I give, and in the end I will tell you the tips and some ideas about the exam, what is the hardness of the exam and how you can crack it, and some important tips. So if you haven't subscribed to the channel, please subscribe it because you will not find such information anywhere. So let's get started. So the FSP exam pattern I have already discussed in my previous video. If you haven't seen it, please watch it. As I said in that video, FSP exam is divided into three parts. The first part was a patient-doctor conversation. So in my exam, there were two examiners, one male and one female, and there was no patient. One of the examiner acted as a patient, and I was sitting in front of them, and both examiners were in front of me. So I received a paper, a history paper, in which the basic detail of the patient was there. For example, name, address and age, and what are the systemic diseases, and what are the allergies, what is the patient taking any medication or not, or something like that. And then I started talking with the patient that what are the chief complaint and all that stuff, and patient said that she had pain in upper left tooth. And then I asked other questions like since when you have pain, and what is the problem happening, are you able to chew, and are you taking any medication or not, and something, all that basic stuff. And after noticing all that stuff, I explained the patient that what can be the possible scenario, and I advised x-ray of that teeth. So I was received an x-ray, and then I described the x-ray to the patient. It was tooth number first molar in upper left, and it was already root canal treated, and there was a periapical infection was there. So I explained the patient that this is the thing, and normally in this case we will go for re-root canal. And I explained all of the stuff, and patient had asked some questions regarding how much time it will take and what is the procedure and all that stuff. You just have to explain the patient everything just like what you do in your practice. And yeah, that was my first style, which was a doctor-patient conversation. The second tile is your documentation. In that tile, it was a surprise. The examiner told me that now imagine the scenario that you have started a re-root canal treatment and you have broke one file in mesiobuccal canal, and you are not able to retrieve it. So now you have to refer this patient to an endodontist, and you have to write down a reference letter to him. So it was a bit of a surprise for me, and then that was a 20 minutes time. I had to write down that later. And so it was very, what I would say, you have to hurry up in that situation, because you have to formulate entire thing in your mind and then write down everything in detail, what you talk with a doctor in doctor's language with all the vocabulary and stuff. And yeah, that was a 20 minutes time. And the third time was doctor conversation, so that was a viva part. So in that the examiner first told me that now imagine the scenario that endodontist is not able to recover that file also, and he now suggested that you have to do extraction of that teeth. So you have to refer this case to the oral surgeon. So I am now an oral surgeon, and you have to call me and talk me on the phone and explain me the entire situation. So I did that. I called I behaved like I called that doctor, and I explained the case, that what is the case and what has been done and what you will have to do. You have to, that is important that you don't read and you don't speak the entire story. Just you have to focus and say the important points, what is important for that oral surgeon to know. And yeah, afterwards they asked about the normal questions like the root canal procedure, what are the steps to do it, then after the extraction what is the possibility, and then I said that it is removable and fixed prosthesis and denture and crown and implants and bridge and implants. And then they asked me all that stuff regarding then the implant viva was started They asked me about types of implant, what are the parts of implants, and what is the procedure of implants, and then in this case it was upper 6, so there was less amount of bone. What will you do? Then I said that I will first do a CBCT and then I'll do sinus lift. Then they asked me about the sinus lift, types of sinus lift surgery, describing all the direct sinus lift, indirect sinus lift, or what are the instruments which are used, and then about the bone grafting, the types of bone graft, what are the materials you should use, what should not be used. Everything was in very much in detail. Normally it is a 20-minute viva, but my viva took around 30 minutes time. They asked me so much in detail, and in the end they told me that wait outside for 5 minutes, and I waited outside, and they were checking everything, and after 5 minutes they called me and they told me that what are the things I did bad and where I should improve. They in the end they told me that I have passed the exam because I have good knowledge, and I was able to explain everything good to the patient. I was very confident, and I was not nervous, so I had passed the exam. So this was all about my exam personal experience. Now the $1,000,000 question that I've always been asked by people, that how hard is this FSP exam? Well, to be honest, what I would say that there is no universal answer to it. The people who pass the exam will say that it's easy. People who not, they will say that it's hard. But honestly speaking, what I would say that it's not 100% easy. That you don't prepare good and you just walk into the exam and you think that yeah, you will pass. Even if you think that you have a lot of experience and you will answer anything, well, it's not like that, because the exam scenario is little bit different. And but I would also say that it's not impossible. It's not very hard as well, because when you compare it with the other grade 1 countries like US or Canada or Australia, all these exams are nowadays literally impossible to pass. Compared to that, it's nothing, what I would say. The passing rate of FSP in a first trial is around 50%, because most of the time what happens is that it's the first time we are giving an exam, so people are nervous and they are not able to express themselves. They are not very well prepared. They don't take this exam seriously, and examiners will always see that if you are nervous, they don't like it. They would want you to be very attentive, and presence of mind is very necessary. I will give you my example. In my case, when I was asking history to the patient, it is a protocol. There is a history format which you follow. It was a 30-year-old female patient, so I asked her that, are you pregnant? So she acted like she got offended that I asked her a personal question. So it's like, I am here to do my dental treatment, why are you asking me the personal questions? So in that scenario, normally what happens is a guy who is asking the female a personal question, German female, your examiner, and she acted offended. So you will get a little bit nervous and you will feel that what I have done. But no, in that scenario, you have to back yourself that why you have asked a question. So in my case, I told that I understand your problem, but it is very important for us to know all of the things, because if we are going to do any treatment and if you are pregnant, then we are not able to prescribe you some medications, and also we will not be able to perform some treatments in some period of time. So I backed myself, and then the examiner said it was a good answer. So it is like that you have to be, sometimes people get nervous in the exam and they are not able to answer such stuff. So that is the reason 50% of the people is the passing rate of the first time. But the second time, this passing rate goes up to 90%, because the same people who now had an experience of the exam, they know that what can be asked, they prepare hard, they work hard, they work sincerely, and then they will be able to clear that exam. Those people who still don't work hard and don't prepare good, then you can give FSP exam 1,000 times, it doesn't matter, but you have to be good in that exam. So I would say that FSP exam has unlimited attempts, so you don't have to worry about the attempts in that region. But you have to understand that you have to wait 3 to 6 months time for to get the second appointment. During that time you will be financially on your own, because after those who have already found the job before FSP exam will, after when they will get the certificate, they will get the job contract and they will directly apply for the work permit, which takes around 4 to 6 weeks time. But those who don't find the job before, then after the exam they'll have to find the job and then they can apply for the work permit. So during that entire time you will be financially on your own. So just be smart about it. My suggestion would be to always work very hard, always do preparing in the exam. You might find one or two or here or there cases that they are lucky enough that even though they have not good prepared, they have passed the exam, but that are only 5 to 10% of the cases. I would always suggest that instead of relying on your work, always rely on your hard work and don't on your luck. So that way it's very beneficial. Practice all these possible scenarios and what can be asked, what cannot be asked. Do some good FSP coaching classes, and after that do some good exam simulation with a good mentor. Don't hesitate to invest in those things, because even if you don't prepare good and if you fail FSP exam in a first try, you are anyway going to lose that 3 to 6 months of your work time. So instead do a good preparation. Don't get nervous. It is not impossible to pass the exam. It is just required to do a good preparation. What I would say that if you do this much of preparation, this much, then this much amount of exam will fill you this much. So it's simple as that. So this is what I would say. My suggestions to you, those who think that this FSP exam is very tough for them, or those who are very fresher to this thing and not very much experienced, and those who think that this pathway is a little bit risky, they can always choose the dental hygienist pathway, which is already, I have made a very important video about it. And those who think that which pathway should be good for them, those who are confused, those who are even in between the process and in confusion, they can contact me. The link is in the description box. You can book your slot and we can talk personally. That way I'll be able to understand your scenario, what is your situation, because it's not a universal thing that I can suggest anyone to do that until and unless I talk with that person personally and I can say that how confident you are, how good you are in your stuff and all that stuff. Then I can suggest you the stuff that which pathway is good for you, what you can do to improve. So yeah, that is all about what I would say about FSP exam. So don't get nervous, just do hard work. In coming videos I will be taking interview with other dentists who have passed the exam and gone through the process, so we can also understand and learn about their journey, and then we will move ahead with the KP exam things. So those who have not subscribed to the channel, please subscribe it and hit the bell icon so you will not miss these important videos. Until then, have a nice day.